Are you looking for some ways to self-massage your shoulder because you're having shoulder pain and you're not sure exactly what you can do to relieve it? Today, we're going to discuss a self-massage routine that you can do to hit the most common pain generators with shoulder pain. But before we start, a lot of people ask me if they need to use lotion when they're doing some self-massage. Now, most of the time I do not use lotion because I'm a physical therapist and I don't have people fully undress while we're doing physical therapy, but I know a lot of people are used to that from massage. So if you feel like you want to use something, you can use any kind of lotion that helps glide. Really, any hand lotion or anything like that will work. If you're looking for something that's safe and effective to help decrease your pain, I definitely recommend this stuff. This is True Love Skincare Deep Rub. So it's kind of like an icy hot, but it has all natural ingredients. I don't like to use the chemicals that are in the other products. This is all natural ingredients, but it has the same effects as icy hot. So if my shoulder is really hot or irritated, or it's just really, really tight after a long day of work, I'll definitely put some Deep Rub on it to help get the benefits to the muscle. So for the purposes of this video, I'm going to show you the techniques I use most commonly over clothing, and then I'll show you some that you can use with the Deep Rub. If you started to have shoulder pain, you may have also had it go up into your neck. So there's a lot of muscles that attach from your neck into your shoulder. So when people are having shoulder pain, often it starts to become hunched. And whether it's the hunching that causes the neck stress, or if it's neck stress that caused the hunching in the first place, kind of a chicken and an egg question, but that's always where I like to start, because anybody who has shoulder pain has tension in their neck. And that's where I carry my tension to. So that's where I always start, and it's a muscle called the levator scapula. So it is attached from the neck to the scapula or the shoulder blade. And it is one that I find to be very tight in 100% of my patients who have shoulder pain. So that's where I like to start. So we're going to say that it's my right shoulder. And what I'm going to do is I'm going to reach under here. And the levator scapula is kind of back here. It's this big, ropey muscle. You'll kind of feel it. Now, to be fair, the upper traps are on top of it. And so it's a little bit hard. Like my upper traps are tight right now, and I can kind of squeeze them right there. So I got to get underneath that. And I do that by pushing my thumb in, and then you go, oh, that spot right there. Yes, that spot right there. That's the one we're going for. So what I will do is I'll kind of tilt my head if it's really tight, which mine is right now. So I'll tilt my head to the right side. That helps to decrease the stress on the levator scapula, and then I can really get my thumb in there. And I'll just do a little cross-friction massage, which means moving my thumb back and forth. Now, this can be a little bit challenging for people because it is a little difficult if you don't have like super strong thumbs, or if you have a thumb that hyperextends regularly. Now, if that's you, what I'm going to recommend you do is that you're just going to go ahead and you're going to grab it like with your fist, basically. You're going to grab that whole thing. So you're going to get upper trap in there too, but hello, whose upper traps aren't tight? And then what you're going to do when you've got a good hold on it is you're going to look as if you're looking underneath your left armpit. This is called a pin and stretch technique, and it is super helpful to get that muscle nice and relaxed and calmed down. And yes, it works the upper trap as well as the levator scapula, but chances are good that they're both a problem anyway. All right, another very common muscle that gets overlooked when people are talking about shoulder tension is the pec major and the pec minor. The pec major is the more superficial muscle or closer to the skin surface. The pec minor is underneath it. And a lot of people don't know about the pec minor, but the pec minor specifically attaches onto that shoulder blade and can draw that shoulder forward. So it's really important to make sure you're massaging both of them. Usually as you go along, you'll find a good knot. And honestly, if you don't know if it's the pec major or the pec minor, it doesn't really matter, right? As long as you're working the knot and getting it to release. Now, this one in particular, I don't really like using the lotion for, and this is a personal preference. So try it both ways and see which way works better for you. But when we're working the pecs, I like to use more of a fisted type motion because it's hard to get into that pec minor. And I feel like if I'm doing more of a gliding, it's harder to get into that muscle. But again, try it with lotion, try it without, see which one works better for you, because it's really the outcomes you're looking for that you're working towards. All right, so how do I do it? So you can use your fingertips. Again, if you want to use lotion, that's what I would recommend potentially, at least starting with. And you want to start right near the crease of your shoulder. So you're going to start right on the inside. You can go along the clavicle or the collarbone, and you can see if you can find any tender spots. So I found one right there, and that's really nice and tender. And you can follow it down all the way across that collarbone. But the pec major is bigger than that, so you can go back to the crease. Now you can go as if you're in a diagonal and you're going down towards your belly button, is what I would say. And there's some nice tight spots in there too. Again, the pec major, it's a huge muscle, so we can go back to the crease and we can go down as if we're going down towards our right hip on this side. And there's some nice tender spots in there. Now, if you feel like, oh, that's a good tender spot, but I can't quite get into it with my fingers because my fingers aren't strong enough, that's where the fist comes in. So I'll make a fist and I'll put my knuckles in there and really try to dig that out. That can be really, really helpful just to get it to massage around, to move around and decrease some of that tension in that pec major. Maybe you're getting that pec minor as well. Now, if you feel like, my hand's just not strong enough, I can't get it with a fist, or it feels like it's too deep, the other thing you can do is take a racquetball. It might be helpful to stand in a doorway, and you're going to put the racquetball on that tight spot, and then you're going to put yourself up against that racquetball and kind of roll it around. So you kind of have to move your body in that way. That can be a nice deep pressure applied to either the pec minor or pec major. So to find those tender spots, I have people usually start with fingers because it's a little bit easier to palpate or to feel those tender spots. If that doesn't feel deep enough or your fingers are getting tired, switch to fist, and then you can get a little bit deeper in on those tender spots. And then what you're going to do, if you feel like you need a little bit more bang for your buck, is you're going to use that racquetball in a doorway, and that's going to help you get to those deeper tissues. Okay, so now we're going to start working the rotator cuff muscles. We're going to start with the supraspinatus, which is the muscle that's right here above the spine of the scapula. Now this is one where I might use some lotion because it does help to get a little bit of glide. So I'm going to get a little bit of the deep rub, and a little bit goes a long way with the deep rub, so you don't need that much. And I'm going to go right above the spine of the scapula. So the spine of the scapula is that bone that you can feel right there. You're like, yep, that's a bone right there. All right, so you're going to stay right above that in that kind of groove. And I like to just kind of press in there and find those tender spots. When you find one, you can kind of go across it. This is called a cross friction. But for some people, it's so tender that just going up and down it is really the best thing for them. Now, moving on, we're going to work on the infraspinatus and the teres minor. So these guys are below the spine of the scapula. And what you're going to do here, I like to kind of cross. So this time I'm crossing my right arm over my left shoulder so I can kind of hold on to it. That helps to bring it forward a little bit more. If I leave my arm down at the side, well, one, it's kind of in a weird spot because I've got my hand back there. But the other thing too is that it's a little hard for that left hand to reach all the way back there. If you have somebody else who can do this for you, that would be fantastic. But again, if you're trying to do some self-massage, this is what I would recommend, is putting your right hand on your left shoulder to help bring that scapula a little bit closer and make it a little bit easier to find those tender spots. Now this one goes all the way across and attaches to the humerus, which is the arm bone. So you want to make sure you go all the way along that length. So getting all the way through there. And sometimes it's really that tendon that's really tender. So today my tendon is really tender as opposed to the muscle. But again, you want to use the lotion to kind of explore these muscles and find the tender spots. And then when you find one, that's when you want to work specifically on that location. Okay, so next is the subscapularis, which is a muscle that is potentially going to give you a big bang for your buck. It's a little bit hard to get to because it's actually sitting underneath the scapula or closer to the rib cage. So what I like to do is put my thumb, and you're going to stick it up in your armpit, basically there. And I like to kind of bring my arm out to the side that pulls that shoulder blade out a little bit and makes it a little bit easier to find it. Now you do have to be careful because of course the lat is down here as well, and it's a bigger muscle, so you may get fooled by the fact that it's a lat, but that's okay. If your lat is tight, you should work on it too, and this is a great way to do it. But what we're trying to do is get to that subscapularis, which is underneath that shoulder blade, and there's always lots of juicy spots in here, on most of my patients at least. So if you're having shoulder pain, there's probably some nice juicy spots in here. I definitely have some today, and I like to go up and down. You can do a little trigger point work or putting some pressure on there for 5 to 10 seconds and then releasing to see if that helps to release things for you. Or you can do what we call a pin and stretch. This one's a little bit more difficult because it's hard to pin the muscle and then stretch it. But what you would do, oh, that's getting a decent stretch in there. What you would do is you'd find that tender spot in the subscapularis. You would hold it down with your thumb, and then you're going to lift your arm up basically to horizontal and then back down. And that feels like a nice stretch on that subscapularis. So multiple techniques that you can use on this area. It's a little bit difficult to get into, but you're going to get a lot of bang from your buck for working this muscle. So there's my favorite techniques to go ahead and massage your shoulder to decrease pain. I like to start with more of the neck muscles, including the levator scapula and obviously the upper traps. I like to move then to the pectoralis major and minor. Then I want to work to the rotator cuff muscles, so the supraspinatus, infraspinatus, and teres minor, and finish up with subscapularis, which is the one that's underneath that shoulder blade. Working all of these muscles individually should bring you a lot of pain relief. You may be a little sore the next day after doing it. As long as it's a good sore, that's okay. Now, if the next day you have more pain or more specifically less motion, you may have done a little bit too much with this massage. You may need to take one of the muscles out that you're massaging because it was just too aggravating or it's too tight, or you may need to just do a little bit more work. I usually spend about 2 minutes on each muscle, and again, it depends on how crunchy each of them are. For me in particular, my levator and my upper traps are a bigger issue than my shoulders specifically, so I usually spend more time in this area because that's what causes that shoulder elevation for me in the first place, but everybody is a little bit different. So find those really juicy points, those really juicy muscles that give you the most bang for your buck, and then work on them a little bit more. As long as the next day your pain is not increased and your motion is not decreased. That's the most important thing, because movement is life and every tissue in your body is designed to heal itself as long as it's moving correctly, which means these massage techniques are designed to help your shoulder move better. Now, if you're looking for some specific exercises that you can do after you do this, I'm going to recommend you check out this video here, which is going to give you some exercises that will help to improve your rotator cuff and shoulder motion.